What's good, everyone? Welcome to episodio dos in the Lemme series. It is me, your captain, Shraz. I hope you guys have a safe flight. Hopefully you have no turbulence, but we'll see how we go. Anyway, today's topic is back pain. Someone has asked us on our social media, I've had side for 10 years, help me. So I've taken a bit of a step back, generalized the thing, 10 years of back pain. Now, we're going to dive in deep. Pause. I hope you guys have got your scuba gear here today because it's going to be a deep one still. I don't know about you guys, but I'm a visual learner and I like learning things through like drawings and diagrams and things of that nature. So, I've drawn out here the brother that sunk the Titanic. RIP the Titanic. This is the best I could draw. Man split. And I've got a hashtag, save me Shraz, because I'm going to be doing some saving today. Anyway, so 10 years of back pain. In order for me or anyone to help someone who has had chronic pain for that long, we have to dive in deep. And 10 years is a significant amount of time to be dealing with pain. So I have created 4 essentially levels that we're going to kind of take a lift through and talk about each one. So the first one is the surface level. So what happens at the surface level, might you ask? Real easy, isn't it? Surface level questions. Now, this is what most people will look at, and before we even go to some of the questions that like I might ask, most people are operating here and they're trying to fix here, and if you're kind of just operating from the first level, most people are thinking about what stretch will help me. Should I do ice? Should I do heat? And people are looking for a temporary sort of relief, like massages, dry needles. All that stuff is definitely great, but you've had pain for 10 years, big man. And I want you to think about like this, that most people here will Google and they will jump practitioner to practitioner because they're looking for a magic fix. Now, I hope this isn't new, and I hope you aren't looking for a one exercise will solve everything, because it's not. Big man, you've had pain for 10 years. How is one exercise going to Harry Potter your way out of pain? Doesn't work like that. Now, you come into the clinic and you tell me you've had back pain for 10 years. Some of the questions that I'm going to ask in the first session is, how long have you had that pain? You obviously said 10 years. Is your pain off and on? Like, is that pain always there, or does it come and go? If it does come and go, what are some of your triggers? What are some things that piss off your back pain and your sciatica? Because we need to identify what exactly it is. That's level 1. Pretty surface level. I feel like that's like your standard question and answer in a physio consult. Now, let's dive in deeper. Level 2, movement. What does that even mean? Alright, let's get into it. So movement. Now, in movement, we are looking at your biomechanics and how you move every day. So, this includes movement patterns. We're looking at your nerve mobility and sensibility, breathing and bracing with and without loads, your posture, your walking, movements such as your squats, deadlifts, your hip hinges. All that stuff is super important because chances are some of this stuff is going to be abnormal. And what I mean abnormal is, let's just say you're squatting. First thing that's going to happen is when you brace, your low back is going to brace, core's not even going to be on, glutes will probably cue later into the movement, and essentially your motor control is all over the place. Why? Because your brain, shout out the brain, has figured out ways to avoid essentially pain, if that makes sense. Because I want you to think about it like this, right? Normally in a movement, let's just say squats, you would like to brace, and we are bracing the core. Naturally, your core is everything from front to back. We would like to brace, or we would like to bias is probably the correct word. like your front/side first before anything else, right? So once you have braced the core, the next thing you want to do is activate the glute. And what I mean activate the glute is that you should feel some sort of tension in the glute. And then as you go into the movement, your back, as you go into the movement, your back essentially becomes like a synergist, right? So think of it as this is the ideal order that would like to go down. Core's on, glutes on, back's doing a bit of an assist. If you've had pain for 10 years and we're looking at your biomechanics, there's a good chance it could be going the other way. So the big thing the big muscle bracing your squat would be your back erectors. That's the first thing that kick in. Then the next thing might be your glute or your hammy, so glute or hamstring, and then it might be a core. So that's what I mean by like biomechanics and everyday movements. We have to see and identify what's moving, how is it moving, what's the structure and the order, and how's your motor control. That's level 2. I hope you guys are still with me. I feel like with number 2, that was a bit of a tricky one. Might have had a bit of turbulence. But as they say, the show goes on. Level 3 is load. And what I mean by load is what are your habits, the loads that you deal with every day, and what are like some of the stresses that you are dealing with. Now, a lot of people who have had pain for 10 years, they are most likely either chronically overloaded or underloaded. We also need to investigate their training routines and the structure of their training. Are they overtraining? Are they undertraining? Do they even train at all? What's even a gym? Actually, shout out Jim, man next door. He's a good bloke. We also have to look at the sleep. Are they getting enough sleep? Because a lot of your recovery happens when you sleep. And if you're not sleeping, when do you recover? Think about that one. All right. So, next thing, I've got lack of recovery. And the last thing is how is your supplementation and nutrition? Because if you have a nutrition deficiency, there's a good chance that it can be causing some inflammation. Now, I don't dive into that side of things. That's for a nutritionist, but something to consider. So, what are your habits, your loads that you're dealing with every day, and your stresses? That is super important. Most people don't even consider any of this stuff, especially habits. Anyway, let's move on. Level 4. Now, this is so important, super important. Most people don't even get to here, but this is where I feel like a big chunk needs to be worked on. I don't know if that makes sense. Anyway, I'm gonna say that again. So, level 4 is probably one of my let me restart. Level 4 is the most important thing for people who are dealing with chronic back pain, and we are into the depths. What does that mean? I got you. Here we're talking about the mental and emotional side of things, especially things around your beliefs. This could look like fear around movement or re-injury. You could be frustrated, you could be feeling hopelessness, or there's even like an identity crisis. You could be dealing with stress, anxiety, and a lot of people here, there's a lot of pain catastrophizing. And what that just means is you experience a little bit of pain and all of a sudden in your brain, like you associate with damage. Pain does not always equal damage. Let me write that down. Pain does not always equal damage. I hope I don't look real fruity here. I do look a little bit fruity. Look, it is what it is. So pain does not equal damage all the time. Your pain system in your body is actually a defense system. If you touch, let's just say, a hot pan, your brain will automatically protect you by moving your hand away. That's just how the body works. So pain does not always equal damage. And that's something some physios look into and talk about. As we go deeper into it, some people associate pain with their identity. Oh, I've got a bad back. Yeah, I've got a bad back for 10 years. Oh yeah, my knee's no good. Tore my ACL when I was like 17 and now I'm like 605 and my knee's ongoing. Okay, I've got to chill out with some of the remarks that I'm saying, but I hope you understand what I mean, where identifying pain and constructing that into your identity is never a good thing. It's never a good thing, because essentially what I believe is that if there's bad and there's good, right? If you focus on the bad, you're giving more energy onto the bad, right? And as the time goes on, like, it just continues to grow. So yeah, here are the 4 levels. In order to truly help someone who's had pain for 10 years, we have to work through all of these levels. We have to ask the surface level questions that we always ask. What is your pain? Where is it? How long does it stay for? Your triggers, things that make it better. Once we get an understanding of that, then we need to look at your biomechanics. How do you move? How are your everyday movements? How's your squats, your hinges, your deadlifts? How's your walking? As we go deeper into that, then we need to look into things such as your habits. What are the loads that you deal with, and what are your stresses? And then finally, this is the jackpot: knowledge. The jackpot is looking at your mental and emotional side, and what are the beliefs around pain, your back, exercise, activity. Because essentially, what I've seen so much in the clinic, example, we're at the clinic, we have a new client, clients come in, tell me, yo, broski, I've got back pain, I've had back pain for 10 years, GP said that I've got a disc bulge, the disc bulge was 10 years ago, scans picked it up, and it's just lingering, it's just always there, it's never going away. So, I don't know if you guys know this, but there was a study that came out, and the study said that 1 in 3 people who have disc bulges, the disc bulge will get better by itself in 3 months without any physio. It will just naturally get better. There was the other third, the second third got better with physio and exercise within 3 months. And your last group did get better, but it took greater than 3 months. And there was a small subsection that didn't get better. I don't exactly remember how much it was, but I'll pop it here. But essentially, what I'm trying to get at is there's a good chance that whatever structural injury that you had, in most cases, would have resolved within the first year. I do want to explain some of my drawings. You guys must be like, this guy's mad. Like, this guy's doesn't even know what he's doing. Oh. Alright. I'm gonna leave the fish. I've already explained the Titanic. Big up the Titanic. I've actually never seen that movie. Have you watched that movie? If you have, let me know. Is it a good movie? Shout out Leo. Let's get rid of this one as well. You guys must think I'm like a bit of a psychopath with the way that I'm rubbing it. But I'm just trying to save my little fishies. Anthony's a back pain. Alright. So, funny story about this. Obviously, we got the brother that sank the Titanic. We got some fishes. We got the actual Titanic. We got some treasure. Now, these fishes. Obviously, this one's me. Man's doing a pouty face. It's like, that's me as a fish. Just plotting away. This brother is mewing. Now, story is couple weeks ago, I had like a family event. Went to my cousin's house. It was his birthday, and essentially all the family's there, and one of his cousins on the other side of the family comes over. I think this guy's like a 13-year-old, 14-year-old lad. Comes through. Hair's like covering his eyes. I don't even know if the man's got eyes, but hair's down here. And essentially the whole time, obviously I said hi to him, but I don't even know if he said a word. He's like this, moving the whole time. That was crazy. Like, he didn't say a word, sat down the whole time, was in constant mew like his last name was 2. Madness. I've never seen anything like that. he had hella aura though, so big up to him. Anyway, so while I was reading the fishies, I don't know, it just reminded me of that guy. And while we're on this topic, I feel like I don't know if you're like close to my age. I'm like in my like mid to late 20s, and it's interesting because like we're in this middle generation where like we're not unks and aunties yet, but at the same time we're not the iPad kids. We're in this awkward generation where I don't know. It's just us. Anyway, I don't even know what I'm going with that, but yeah, like that's my motivation for these two fishes. It's me and the man them just I'm pounding away and he's mewing. Anyway, yeah, so that's episode of Your Thoughts. If there's any topics you'd like me to cover, I will try to present it in very visual ways. Iceberg, fishies. Yeah, I don't know what else to say. Peace out.